This video is about nursing process. So first one is introduction. The term of nursing process originated in 1955 by Howell. Nursing process is a foundation of nursing profession. It serves as a guide for professional nursing practice, which identified and discovered healthcare need of the patient, family, and the community. The nursing process enables the nurses to organize and deliver nursing care. The second one is definition. The nursing process is defined as a systematic rotational method of planning that guides all nursing action in delivering holistic and patient-focused care. The nursing process is a form of scientific reason and requires the nurse's critical thinking to provide the best care possible to the client. The next is objective. At the end of this, professional student will be able to know that what is the nursing process, what are the characteristics of nursing process, and what are the benefits of nursing process. So next one is the characteristic of nursing process. First one is systematic. This is part of order sequence of activities. And second one is dynamic. This is great interaction and overlapping among the 5 steps. Outcome. Outcome oriented. This is nursing and patient work together to identify the actual cause. The outcome interpersonal. Human being is always the heart of nursing. And the last one is universal applicable, a framework for all nursing activities. The next one is step of the nursing process. This is 5 step: assessment, diagnosis, objective means outcome identification, planning, implementation, and evaluation. The phase is nursing process. First one is assessment. During the assessment, the nurse will look at any subject and object data collected in the patient history. And then second one is diagnosis phase. In this diagnosis phase, during the diagnosis phase, you will take those assessment findings and formulate a few nursing diagnoses that will guide your care for the shift. A nursing diagnosis is separate from the medical diagnosis. The medical diagnosis and will be subjective based on your nursing judgment. And the next one is planning phases. The planning phases is also referred to as the outcome phase, and it is the step is help the nurse to start formulating planning of action. During this phase, nurse will create some goal of the shift. Means goal for shift. The nurse will create some goal for the shift. And the next one is implementing phase. As the nurse, what are the action items you will take to see this goal are met? During the implementation phase, you will create a few nursing interventions to help achieve the patient goal. The final stage is evaluation phase. In this phase, it takes to place following the intervention to see if the goal have been met. During the evaluation phase, nurse will determine how to measure the success of goal and intervention. And then next one is care plan. In this care plan, first one is assessment data, and then nursing diagnosis, objective nursing intervention, and then nursing implementation, and then last one is evaluation. In this assessment, subjective and objective data, and then diagnosis means full example I give here, so you just check it. And if you like my video, please don't forget to subscribe my channel and on the bell icon for my new videos. Thank you.